Good evening, everyone. My name is Jamal Taban, and I'm currently attending the University of Texas at Austin as a mechanical engineer, and I will be your host today. I would like to welcome all participants on behalf of Dialogue Institute. It is our goal to help bring communities together in order to promote compassion, collaboration, partnership, and community service through dialogue and conversation. Towards this goal, we organize intellectual, social, and cultural events such as Dialogue Matters and informal discussions with prominent speakers on various topics. Tonight, we have two very special speakers from Success by Six who are seeking to reduce barriers to children experiencing healthy, safe, and learning environments at home and in their communities. Kathy McHorse is the Vice President of Success by Six. Together with our community partners, Kathy leads local efforts to improve early childhood programs and services for children and families, with the goal of ensuring that all children enter kindergarten happy, healthy, and ready to succeed. Martina Santesteban, who is the Community Alignment Manager for the Success by Six team and leads the Central Texas Perinatal Coalition at the United Way for Greater Austin. Working alongside Austin Public Health, Martina supports the Family Connects Austin/Travis County team and assists in connecting families with young children to appropriate resources. Now let's welcome Kathy and Martina.
Thank you so much. Thanks for having us. We're really excited about presenting today. I am going to try and do the screen share, so I appreciate your patience if I have any technology bloopers.
Yeah, thank you for having us here today, and we are excited. Anytime anybody has a question, feel free to come off mute or put it in the chat, and we can answer those as we go or at the end. So we want to just start off with a general question, and if you wouldn't mind either voicing or writing in the chat, what do you think is a kiddo who is ready for kindergarten like? If you had to describe a child who's ready for kindergarten, what does that look like? Any thoughts? And that's okay. Maybe you don't have an idea. I don't want to say because my kid is in kindergarten, so I don't want to give the answer. But this is just something to keep in your back of your mind as we are presenting today. What do you think that looks like, right? And again, a child who's ready for kindergarten. Kathy, next slide. So you may or may not know that 90% of all brain development happens within the first 5 years of life. When I first learned that, I was, shocked to know that all those neurons and everything that happens in a child's brain in the first 5 years are very crucial and critical. So we wanted to share a small video, it's pretty short, to tell you more about that.
What are my hopes for her future? I think what's most important to me is that she's healthy and happy.
I want them to be responsible and respectful and successful.
Curious about the world, someone who loves learning.
To give back to her community.
I want my child to have the opportunity to follow his dream, whatever that is.
I am really very open about what they want to be in the future. I want them to be whatever they want to be.
Every child deserves the chance to reach their full potential. And as science continues to advance our understanding of child development and of the human brain, we know that the seeds of a healthy, successful life are planted in the early years. From day one, babies are born learning. Their brains are growing and developing at an amazing rate. In the first 5 years, faster than any other time in life. And how a child's brain develops in these early years will have a huge and lasting impact on their future. At birth, a baby brain is only a quarter of the size of an adult brain, but will double in size during the first year. By age 3, it will grow to almost 80% of adult size, and 90% by the time a child starts kindergarten. And while the brain is growing in size, it's also forming billions of connections. These connections between brain cells are what really make the brain work. And as the child grows and develops, the brain cells connect with each other in more complex ways. Different areas are responsible for different abilities, but they're all interconnected. They all contribute to the child's overall health and well-being. These early brain connections set the stage for higher level skills to develop later on, like motivation, focus, problem solving, and getting along with others. Things that really make a difference in a person's ability to learn and do well in school and in life. The first few years of life are the best opportunity to develop this network of brain connections. It's much harder later on. Connections that are used more often become stronger, while those that are not used are eventually eliminated, making the brain more efficient. Building brain connections is like building muscles. Use it or lose it. But these vital connections are not made automatically. They don't just happen. So how does healthy brain development happen? Through positive, stable, nurturing relationships with parents and caring adults. Study after study shows that caring interaction, stimulation, and love during their first few days, weeks, months, and years help a child feel safe and secure and help their brain develop a strong, healthy network of connections. Unfortunately, the opposite is also true. Neuroscience shows the dramatic impact of persistent negative experiences and toxic stress. Fewer brain connections develop, and at a slower rate. They also reinforce negative brain connections. Too many of Arizona's youngest kids face the kind of challenges that make it difficult for healthy brain development, like hunger and neglect. The evidence is clear. Positive, nurturing experiences in their early years help children feel safe and secure and go on to be healthier and more successful in school and in life. They tend to have better language, math, and social skills. They're more likely to graduate. They're more prepared for college and career, and to be contributing members of their communities. And that.
Thank you. So you did hear Arizona. We did borrow this from Arizona because they are doing a very similar project there. A lot of states are starting to realize. Oops. That's okay. That's okay. Next slide. Of early childhood. So if anybody is wanting to share anything from that video that was new to you, was just like, wow, I did not know that, or was very informative that you would like to share with the group that was maybe surprising to you, either writing in the chat or sharing. And this, you know, maybe you've heard this. I know there's been a lot of talk in the recent years, which we're happy about. But this is what our work is based on. And so the importance of those neural connections and providing those safe and strong environments for these babies from the time the mom is pregnant all the way up to entering kindergarten is our focus. And a lot of families just aren't able to provide these environments for different reasons, and some that are out of their hands. Next slide, Kathy. So just a few more statistics here that you may or may not know. More than 1 in 3 children under 6 living in Travis County live in households with low income. And then 32,000 children under 6 do live in that. I'm sorry, that does come out to 32,000 children. And Kathy, what year is this data from?
This is from 2020.
2020. Okay, so this is the latest from 2020. So that means, and 90% of these children that do live in poverty, of those 32,000, are from households experiencing poverty, are children of color. So that when we look at, you know, the resources and, you know, the number may be decreasing in some areas, but we're still having an issue in our community, and especially for those families of color. So this is what our work is based on, and Kathy will introduce Success by 6.
Thanks so much, Martina. I don't know how much of a surprise those statistics Martina shared with you. How much is that a surprise? I know Austin is well known to be a thriving city, one of those best places to live. People want to come and move here. But the reality is we have about 40 babies born every day in Austin, and those babies are born into these wildly different circumstances. But we know every parent wants to give their child the best opportunities they can. We know they're their first and most important teacher. And so at the same time, they're born into this context in our community, in our state, where accessing services and supports can often feel like kind of a pay to play system where, if you have more resources, you can provide more for your child. And the goal of the Success by Six Coalition is really to ensure that no matter what zip code a child is born in, what neighborhood, what community, that child and that family are able to accesses the resources and supports that they need to meet their needs, to meet the developmental needs of their child, and make sure that that child can be thriving, happy, healthy, and when they walk in that first day of kindergarten, that they're ready to succeed, like they're ready to thrive. So we're going to talk a little more about how we do this work as a coalition. I will say we have alignment with the city and the county, and our coalition has existed for about over 10 years now. Sometimes I think we're a well-kept secret in Austin, but we want to share a little more about that, and then we'll go into a little more detail of what does it mean to get involved. So I'm going to try one more video.
Being a first-time mom, I didn't really know what to expect. You start worrying about every little thing they do and making sure she's breathing all the time and making sure she's sleeping right.
I think the biggest thing for me was the day after the baby was born, because in my mind I was ready for a 24-hour day with the baby coming. Because the day after, you don't have anything left emotionally and physically and mentally.
Who's that?
You don't need much, huh?
The best advice that I can give families is to let them know that each day you're gonna learn more and more about your baby. You are the expert of your family and your baby. And just validating that they're doing a good job, it's empowering them and letting them know that their baby is gonna have a great start.
We know every family is vulnerable at the birth of a child, and everyone needs some support. 90% of brain development, cognitive development, social emotional development, self-regulation, physical development, that happens in a critical period of the first 2,000 days of a child's life. The Success by Six is a coalition of community leaders that includes providers, parents, civic leaders, policymakers, philanthropists, business executive, early childhood experts. We all come together to create a strategic plan to set the course for our community's coordinated efforts to ensure that all children and families have what they need to support optimal development in the first 2,000 days between birth and kindergarten, so that our community's children enter kindergarten ready to succeed at school and in life.
In the school setting, children have multiple opportunities to have many different experiences socially, not just academically, but socially, and to kind of traverse those situations and figure out how to get through them.
When they have those supportive, caring relationships, we see improved academic skills, increased attention span, better social emotional health. A huge range of positives come from that. And it's so important, especially in those early years, to have those kinds of relationships. It does really incredible things for their brain development as well as their behavior and well-being.
Liz, ponte chamarra. Está fresco fuera.
I was 17 when I had my daughter. I did find childcare. I found affordable housing. I had transportation. And when I think about families in similar situations that are trying to get past poverty, trying to move up in life, I don't know how you do it in today's environment, in today's Austin, with the challenges of affordability. So I really want to personally lend a hand to help, because I think everyone deserves the opportunity to move up in life and to have a rewarding career and to have a happy, healthy family.
cuántos pedacitos para poner?
Strong parents raise strong children, which result in strong communities. So an investment by our city into our children and our families in the long term results in a stronger Austin, a stronger community where our children grow up and they have the ability to be successful, to be contributing members of the community. So it's a long-term investment in our community.
Early childhood development is so critical for the workforce of tomorrow. I truly believe that supporting our current workforce, our employees now, so they can come to work and bring the best that they have to your workplace and not have to worry about their children, whether they're in a quality childcare situation, I think that's critical. But it doesn't feel like it's just an education issue, it's really an economic and a workforce development issue.
Our hope is that every child in those first 2,000 days has loving care and opportunity to thrive so that they are happy and healthy and secure with a strong foundation, a strong brain architecture, and they're starting school on a level playing field with peers.
I want her to dream big, and I want her to know that she can accomplish anything.
I want her to be fearless. Hope she raises happy kids too and has a really, really good life.
I forgot how much that video makes me tear up a little bit. It was made before COVID when we launched our strategic plan. So as part of our coalition work, we are actually working on our third version of a community-wide strategic plan, initially launched in 2012 for 3 years. Then we revised it, updated based on the progress we'd made, implemented another plan 2015 to 2018, and now we launched this latest version in 2019. And so as part of this work, we have a framework, of course, that we're working under, and these are our 4 pillars of our framework. And we will go into depth about how do we operationalize these in community and how are ways for community to get involved in this work and support this work and connect it with other work that's happening. One of the reasons our framework is built intentionally in a circle is that we really want to hold family and child at the center, and all of our work is focused on supporting family and children in our community. And then we're driving towards individual child and family outcomes. How do we support each and every member of our community, but also thinking about this system and this sector that can be fragmented and siloed and hard to navigate. How are we building a more coordinated and effective sector so that our early childhood ecosystem is easier to navigate and that we kind of flow through this cycle of development with warm handoffs and no wrong door when a family knocks on it. So there's kind of 2 levels of that work, the programmatic work, and then trying to advocate for systems change, funding, and building streamlined resources that are when you can use your resources most effectively to connect dots and not just create more and more programs that are happening in silos. So Martina and I are going to take you through a deeper dive, but the 4 pillars are healthy beginnings, focused on the health and mental health of babies and their caregivers and that caregiver circle. So it can be their immediate primary caregivers, parents, grandparents, aunts and uncles, as well as the caregivers in their community. Are they in a childcare setting? Are they being cared for in a family home, et cetera? And we want to make sure those caregivers are healthy to really nurture that child. Supported families is focused on connecting families and parents, particularly with the resources they need and the support they need in navigating these early years. High quality care and education is focused on those formal care settings, child care, Head Start, pre-K, and safe and stimulating communities is really thinking about the institutions in our community where families and children interact, and how are we looking at data and policy and equity so that our whole community is really a thriving place for these families with young children. I'm going to pass the mic back to Martina.
Thank you, Kathy. So our first pillar that I am very involved in is Healthy Beginnings. And we like to think of this pretty much prenatal all the way to a baby's first birthday. So the goal here is that Austin Travis community, they work together to ensure healthy births of all children, and also continues to provide physical, developmental, mental health supports and community resources. Again, to make sure that that child and the parents thrive during this time. So we have different partners that we work with for different groups. We work with Austin Public Health, Maternal Health Equity Collaborative, which is does a lot of work to support Black mamas, Any Baby Can, WIC, Travis County Early Childhood. And for example, one of the programs that we have is Family Connects. So Kathy shared the link in there. And Family Connects is a partnership with United Way and Austin Public Health. It is a free one nurse home visit for a mom after she gives birth, 2 to 3 weeks after birth. The nurse goes to the home, or during COVID, and we're still offering over the phone consultations, but it's just checking in on mom, seeing if she's healing okay, she's emotionally feeling okay, how is baby doing? And they do a pretty extensive assessment as well. Do they have all their basic needs met? Are they worried about food? Do they have safe sleep place to be? Do they have health care, a doctor, anything that family and anyone in the household needs? We can direct them to services. The only eligibility for this program is that you are an Austin or Travis County resident. So there's no income eligibility, because we know that, sometimes challenges, it doesn't matter, your income status, it doesn't matter your background, ethnicity. What is important is that someone is checking up on you. And it's a one-time visit because it's meant to connect you to other resources in the area. So Healthy Beginnings is really, again, looking at those first few years. With Family Connects, we did a partnership as well with MCSS. And they actually reached out to us, one of the pediatricians that works with MCSS, and said a lot of the Afghan moms who are arriving from Afghan are either pregnant or they just gave birth, and they wanted to see if we could make sure that we see those moms. So having those connections in the community are very helpful. We also have the initiative of Help Me Grow. This is an initiative to make sure that we're supporting families. We make sure that they get access to resources that they need, and it's developmental support. So seeing any signs of, that maybe a baby needs a little additional assistance, making sure that the pediatricians, organizations, and families are all working together to get that baby what they need. Any questions on Healthy Beginnings? And I'm sorry, yes, MCSS is the Muslim Community Support Services. So one of the things that also came out of this Healthy Beginnings is the family resource page. So if I can share my screen. Our person actually doing the Help Me Grow initiative helped create this. So we do work with a lot of partners in the community. We have a lot of groups and connections, but are always growing. But we heard that parents never know where to go to see information that they can trust, right? There are a lot of questions in those first few years of life. And sometimes it's difficult to know where to go. So we've made this page for family resources. It's available for now in English and Spanish, hopefully in the future in other languages. And it breaks things down by age. So for example, you will go into the age of your child. You'll see different topics here that you can click on. When you click on those topics, it tells you what this topic is about, and then it gives you information, right? So how to baby-proof your home, car seats, what to look for, how to find that. and just different trusted sources that you can read. If you actually need a resource, you can then go to the Connect ATX page, which I will talk about in just a moment with supported families. But just keep in mind when I do talk about that, there is a listing for all of these on Connect ATX. So I will stop and you can take back the screen. So our next pillar is supported families. With supported families. So supported families, as Kathy mentioned, it's just the continuation of supporting, after the first year of birth, they may still need resources. We have groups here that help with making sure families have access to basic needs, making sure they have, again, the food, the transportation that they need. And then telling families about all the free resources that are out there for education and development and parenting classes. Here are some of the organizations that we work closely with under supported families. They're just a few. There are more. But we want to make sure that child is developing well and the family is having financial stability. So one of the projects that we do here is we've mapped out resources. We want to see where in the community there are holes maybe, and there aren't services being provided because we know that not all families have transportation. We want to make sure that, families aren't having to do so much trouble, but they can find information when they go to the grocery store or when they go to their child's school. So going to where the families are and making sure that we're facilitating that process that they get connected. We know that it's very challenging. There's paperwork, there's questions, phone numbers. You don't know exactly what to do. And that's where Connect ATX comes in. So I apologize, Kathy, I'm gonna take over one more time. So Connect ATX is a search program. It's housed by Aunt Bertha. So many of you may have heard Aunt Bertha. But we made a Connect ATX specifically for Travis and Austin area. If you go here, there are many lists that our team at United Way has gone through each one of these and make sure that when you hit one of these, you will find information that is relative, it's up to date, and it still exists, right? So there's a map, and then you get all the information you need of the organization. It's only free or low cost services on here, so nothing that a family would have to pay for. Shows basic information and then how to get contacted. Some of these, you actually use this site and you put your information in, and then the organization will call you back. So this is one way that we're hoping to facilitate, again, the families getting connected with that organization. It's not just phone calls or emails, but they're being connected easily, and they won't, fall through the cracks. Back to you, Kathy.
All right. Any questions so far? We'll keep going. We've covered two of our pillars, so we're on the other half, and then how to get involved. In the United States, we start funding formal education really in kindergarten at age 5. In Texas, we do have pre-K for families who are eligible to qualify for pre-K in the schools. There is funding. Children have to fall into one of 5 areas, including being low income or being emergent bilingual. But in the birth to 3 space, there is no public funding for the general public. So our system in that space, when you need care to go to work and to find someone to help take care of your children so you can go to work, we have a really fragmented sector. A lot of it is provided by childcare. There are lots of different forms or fashions people find childcare. And our goal is really to make sure that wherever a child is in care, if it's not with their family, but if it's in a family-based childcare setting, a childcare center in the community, faith-based, a small business or a nonprofit, or if they're in a pre-K program, that program is receives funding to have the resources they need, that it's accessible to families, that in those classroom settings, there's a low ratio of children to caregiver. They're very young children, need a lot of care. They need a lot of attention to develop. That caregiver needs to be knowledge about the developmental needs of a child, a lot of patience and understanding of what is normal development for young children, and these other qualities, an engaging environment, curriculum and assessments. Children really are born learning. So there's opportunities to build in those skills before they go into kindergarten. A lot of focus on their social emotional skills, self-regulation. Can they learn to share with their peers? Can they communicate their needs? And especially in these settings, finding settings that meet the cultural and linguistic needs of families can be very challenging. So our efforts are focused on bringing those providers together in groups, in meetings, and looking at the policies and funding levers that support these caregiving programs, again, whether it's childcare, Head Start, or pre-K, family-based childcare, making sure that the providers know how to access resources in that space and that families know how to find quality care, because not all childcare is high quality, and it's unfortunate, and often it's you get what you pay for. So we're looking to connect the childcare settings with resources and also leverage more resources to support those settings, because quite frankly, affordability in Austin requires most families to have one or two parents working. And then if one parent is able to stay home, that's great, but we know that's not the reality for all families. So that's a lot of the work we're doing in this space. And I did want to share that, knowing it's hard to find, the state of Texas has launched a website called findcaretexas.gov. And it's online. I can put the link in the chat. And it does help families look for childcare settings that are regulated. That means that they get monitoring visits. They've met certain standards for health and safety standards. And then in this website, they can also have a mark of whether they accept financial assistance and or are they quality rated, and they would have a star by that. And that means that that program is going above and beyond to meet the quality of what the children need. So probably lower staff ratios. They've had some visits to see that there are really warm and warm interactions between the caregivers and children, etc. So we're trying to elevate this as a go-to source in the state of Texas. We're also simultaneously trying to identify those childcare providers in our community that may be doing care for friends, families, or neighbors in their home, and making sure that those important assets in our community, those important grassroots providers in our community, are provided resources and are given access to support in becoming regulated and being able to list their program on this setting so that families can better find them. It's often easier to find a childcare center than a family home, and often families really would rather have their young child, their infant or toddler, cared for in a more intimate setting in a neighbor's home where the neighbor speaks their language, also practices their same faith. And so we're looking to help identify folks in the community who are doing that and help them go through programs to get them connected to these resources, help them connect with families, and quite frankly, turn it into, a regulated business so that they can access some of these state resources. And our last pillar is rather broad. It's really where we're thinking about the whole community. Again, the institutions, the areas where families are present with young children, but often invisible, right? When families enter typically a school system, there is a whole infrastructure that can help them connect with resources should they need them. In our sector, it's fragmented and siloed. We have folks on our team who are gathering community level data and saying, one of the things we learned in Texas, we lost about 20% of our childcare capacity. So even though childcare was scarce before the pandemic, now we have some local data. We know where we lost childcare. We can map childcare deserts and advocate for support to have more childcare in that space. We do advocate. We speak with city, county, and state around different public policy positions and support. We both receive funding and contribute funding. So United Way has what we call community investment grants that we invest to support our strategic plan. On June 3rd, we'll be making an announcement about our next round of funding. And we've also secured some funding to help support the work of these programs. And we're driving towards equity. Again, if you reflect back on the statistics we showed at the beginning, we know that our young children of color are disproportionately impacted by a lack of access. Families have lack of access to these important early childhood services. And we're really trying to look at our work as well internally and make sure that we're operating from a lens of equity and elevating community voice in this work. While United Way was identified to be the backbone organization to lead this work, it doesn't mean we are the deciders of where this work goes, right? We are a neutral convener that is here to elevate community voice and to follow the lead of our community. So we are always eager to share and let community know how to engage in this work. I did want to call out a specific piece of this work that has recently emerged. We have a convening of business leaders called Early Matters Greater Austin, and they're really business leaders in our community who have identified this as a priority and really a priority for our economic infrastructure. That if we're going to have a strong, thriving, long-term community, we need to be taking care of our youngest children so that their parents can be part of our current workforce and they will be contributors to our future workforce. Every year in January, well, we just did our second year, but we'll come up again in January for our third year. We are promoting a Best Place for Working Parents campaign where businesses can take an assessment and see where their policies and practices land on how they impact families, especially families with young children. Are they offering paid leave? Just listened to an article about the baby formula shortage and kind of if we had more paid leave, could families be better able to sustain breastfeeding? Anyway, that was a little sidecar there, but paid leave, flexibility, are there any supports for childcare? How do employers really play a role in this? So if anyone knows of businesses that might be interested in this work, we'd also love to connect with them. And then Martina, feel free to chime in with me here. We showed you our pillars and how do we operationalize this in the coalition. United Way leads what's called a leadership team. That's where we gather our systems agencies. We have the City of Austin, Travis County commissioners. We have the school districts, our Head Start provider, Austin PBS, kind of looking from a governance structure of advancing these goals. But then in the middle, we have our work groups, and that's where the heart of the work happens. We have representatives from many different community-based organizations, and we welcome community volunteers to many of these work groups. And each group has its own, each of these strategies and action steps to try and execute these strategies. So we're moving the needle overall. And then we gather quarterly with whom we call our stakeholders for meetings to just update anyone who says, I share this vision, come to our stakeholder meeting. We give updates on the strategic plan, and we also have calls to action. With that, we have an advocacy email list, and we will send out action alerts when we need volunteers to kind of elevate voice to federal, state, and local leaders on key decisions coming up. And we're going to take a deep dive into questions, but specifically some calls to action for this group. For everyone who's on the call, we welcome you to join as a stakeholder of our coalition. That can be signing up for our email list and just simply following along, and there are calls to action in the newsletters. It can go deeper to joining a work group with our parents and caregivers. We do have a Bright by Text, which I'll ask Martina to talk about in a minute, sharing with other families that there is a group in our community. There are many in our community who are trying to make it easier. We know it's hard, but we want you to know we're working on this. Advocate, join our advocacy list, and you can join the TX as a resource that we can refer you to.
Yeah, thank you, Kathy. I want to make sure we get through those. We can dig in. Kadir, and I hope I'm saying your name correctly, says, I appreciate the work you do for early childhood education. In the presentation, you mentioned that 34,000 kids under 6 in Austin Travis County live in low-income households. How do you reach those families?
So I would say it's through all of these programs. That's how we are trying to reach these families. And I think that's the hardest piece, is we lean on community organizations to help us connect with families. And we really are trying to do the work through the organizations that are serving those families by supporting them in their work. One of the things that's important to know also is that in our community, only 34% of those children are accessing any of these resources in the community, because they're insufficient. There's two reasons. One is insufficient resources to have enough seats for every child, such as in childcare. But the other piece is also we have some home visiting programs that have empty seats, but we don't know how to reach the families who may need them to fill them, because there's not just a single way. You don't get on an email list when you give birth, right? So, and how do we know where families are, and how can we spread that news better? Did that answer?
Yeah, I think that's part of it, but we are constantly trying to figure out and through our groups trying to see how can we make sure that we are reaching those families, right? Again, is it through, on PBS for Bright by Text, which is a free text messaging service for caregivers, we'll do a little blurb on there, but we're trying to improve our relationships with communities of faith, which is another place families go to. We're trying to bring in more key players of their, communities. We don't want to tell you what you need, right? We want to be a support for different types of communities. So reaching out just to different organizations and having parents participate and having their voice be part of our strategic plan and what we are doing and what are we creating, and telling us if we're going in the right direction, if we're missing something. So it's kind of getting everybody involved and doing more things like this today, which we're so thankful for, to getting the word out there, right? So yeah, that's a great question. The next question from Mikan, thank you very much for the presentation and work you do. How many families are you able to reach and help yearly? And I don't know that we have a specific number for United Way, I guess, as a whole, because we, besides Family Connects, and I can get you that number, but we don't do any direct services. So we'd have to put together, all the organizations that we work with. I don't know if that answers your question, but all the organizations that are part of United Way Coalition are helping.
Martina, real quick, I thought I would just share this. On our Success by 6 website, we do an annual update We are behind posting our year 3 update, but there is data that we track to see how many children, for example, what percentage of families are getting home visiting services if they're birth to 3. So in our community, 9% of the families are receiving home visiting services. We could dig into that data and say, and come back to you and say, we know what that number is, we just don't have it top of mind. So I did want to share that we have a data dashboard that we track. I'm terrible with numbers, so I won't remember all of them.
And then I just posted for Family Connects, which is one of the ones we're doing direct services. In 2021, we did serve 2,498 families, and that's only being at one hospital. So because of staffing, anybody is eligible, but we had to start small and build up. So that's being at St. David South. We'll be moving into Seton. Eventually, any baby born, hospital, home birth, car, anywhere will have a right to that visit. So hopefully all of those. Does that answer your question? Icon, yeah. Great, yeah, and we want to be able to share that information, keeping ourselves accountable for the work and making sure we're going in that right direction. So I really appreciate it.
I saw also a question from Margot about how do you specifically connect with AISD schools in East Austin? I'd say our strongest connection is through our pre-K programs. So we're really focused on supporting the pre-K programs. Early on, we were able to help kickstart the pre-K 3 program happening in AISD classrooms. And so we work with the director of early childhood specifically and the parent support specialist. So it's more of kind of that systems approach rather than school by school, I would say.
And adding to that we do events. Recently, we have connected with Equidad that really likes to work on the eastern crescent of Austin. So again, finding those organizations, and if you have any that you know that we should be connected to, please pass our way. I didn't want to skip McConn's second question, which is also a great one. How families can find out about your programs? Is it advertised? So yes, depending on the programs. So one of the places it is advertised is the connectatx.org, right? Which that is a public site. If anybody is searching for early childhood resources, the programs that our partners work with are there. Again, we table at different events, and I think each organization is trying to find, how to do that best outreach in the community. In terms of platforms, I don't know, Kathy, if you can think of any. We do have, our Facebook page where we do share a lot from our partners. We do have the list on our Success by 6 page of the organizations that we work with.
I think we lean heavily on asking partners in our role to support partners for sharing with the families they're serving, and then trying to connect with organizations like yours, like faith-based communities, like businesses, to better learn how can we get information to families that are not yet connected with services and support, and then how do we support the organizations we do work with in improving their quality, expanding their services, and making sure that we are, as Martina said, looking at the mapping and going, wow, there's nobody serving in this zip code. How can we help work with the community to solve that? So it's less about us specifically, and it is more about amplifying and elevating and connecting the work that's happening in the community.
And I'd like to add, especially with Family Connect, something, we have really found these services, and especially because we work with a lot of different backgrounds and cultures, it has a lot to do with trust. So again, finding and identifying those key players in those community or in the hospital or at the school that will advocate for that family as well as share the resources that, you know, our partners and that we are providing to do that link. You know, Connect ATX for us has been very helpful in putting everything in one place, because I know, again, you don't know where to find accurate information. So we're trying to lead families to access information.
And we'd love your feedback on ways we can better not only amplify our presence as far as the coalition work, but other ways to connect with people throughout Austin. I don't know if you all were surprised by any of the data we presented, but often people are kind of surprised, and sometimes after they get out of the early childhood space of parenting young children, it's like they kind of block it from their mind. Like, that was really hard. Childcare is really expensive. That was really hard to find. I was on a waiting list forever, and then they move on, and it's easy to forget because it is hard, and so we want to change that.
I've shared our emails in case somebody has a follow-up question tonight after letting all this sink in. We are happy to speak with you, so please reach out to us.
And I see there's a question, does Success by Six have programs to serve families in Williamson County? The answer is it's kind of a yes and. Many of the programs that we partner with, such as Any Baby Can, Child Care Subsidy, we're partnering with Round Rock ISD. They exist in Williamson County. With the merger of United Way for Greater Austin and Williamson County, we were able to secure a bit of grant funding as well to actually initiate a planning process for a Success by Six strategic plan in Williamson County. We didn't want to just say, oh, this is what we learned were the needs in Austin, Travis County, so let's recreate this in Williamson County. So we actually have a set of ongoing meetings right now to bringing community and providers together, listening and saying, what are the unique needs in Williamson County? It's likely to fall into a similar framework, and hopefully we'll have some links and leverage where we can. But we also wanted to honor the voice of the Williamson County community to develop its own plan and use the data we have there. And if anyone's interested in participating in that planning process, if you email me or Martina, we can connect you. I don't want to throw too many emails at you today. So let us do that work.
If there aren't any more questions, I'd like to end the meeting by thanking the Dialogue Institute for organizing this amazing event, and also would like to give a special thanks to Kathy and Martina for their amazing presentation, and all the participants for joining us on this wonderful day, and I hope you all have a great night.
Thank you all so much.
Thank you.